Living Well, brought to you by Christus Cabrini Hospital.
We're leading up to February, which is Heart Month. Joining us today is Dr. Harry Hawthorne, and your specialty is what?
I'm a cardiac electrophysiologist or a heart rhythm specialist.
Okay, got to keep that heart beating, correct?
Exactly.
Let's talk about atrial fibrillation.
Atrial fibrillation, yes.
Okay.
Atrial fibrillation is the most common arrhythmia that occurs in human beings. And the reason it's such an important part of cardiology is that it affects so many Americans across the country. Probably 2.5 to 3 million Americans have atrial fibrillation. The comorbidities that are associated with AFib are the problem. You're dealing with strokes, heart failure, valvular heart disease. These are all big problems.
What actually happens when you go into AFib?
When you go into atrial fibrillation, you think of this as sort of a total disorganization of the atrium, where the upper chamber is beating hundreds of beats per minute simultaneously. It creates a problem where the heart muscle itself doesn't constrict properly, and blood clots can form in the left upper chamber in a part of the atrium that is sort of a dead end component of the atrium. And when the clot forms in the atrium, it can be dislodged and cause a stroke. You also lose the synchrony between the upper and the lower chamber because of the irregularity of the heart and sometimes the rapid rates itself. That's what causes heart failure problems. The bigger problem with stroke is that about 25% of people who've had a stroke from atrial fibrillation die within a month. These are also big strokes because the size of the clot that is elaborated by the left atrium. Probably 40% of people who have a stroke from atrial fib are never able to take care of themselves again. And the incidence of atrial fibrillation increases as people get older. The peak age of atrial fibrillation tends to be around the age of 65. And if you look at octogenarians, probably somewhere up between 15 and 20% of people in that age group are in atrial fibrillation all the time.
Okay, what do you do to correct it?
Controlling blood pressure, which is the #1 most common cause of atrial fibrillation. High blood pressure being #1, and coronary artery disease being #2. That's why atrial fibrillation itself is such an important part of heart disease, because it can involve many problems that we deal with the heart.
You've described what was going on with the heart. What do we feel like if we're going through that?
Well, having atrial fibrillation is described variably. Some people have no symptoms whatsoever. Some people have described this as feeling like they have butterflies in their chest, like an irregular kind of palpitation sort of sensation. Because the heart itself doesn't have the capacity to feel any sensation, but the sac around the heart, or the pericardium, is richly innervated and can feel all kind of various movements of the heart.
Okay, so the message is, if you're feeling that, what?
Yeah, if you feel your pulse is irregular or rapid, or even sometimes slow, call your doctor, because if it's not atrial fibrillation, it may be something else that is dangerous as atrial fibrillation also. It's better safe than sorry. And again, the faster you can find atrial fibrillation, the faster you can correct it. Because time is very important, because the longer you've been in atrial fibrillation, the more scar tissue develops, and it may be harder to restore normal rhythm in the long run.
For more information, call 866-581-3627.